It was not necessary to repatriate. We also said it was not necessary to do that, but that was on the basis of how the disease is manifesting and how the treatment protocols and the prevention measures were being embarked upon. That was also before South Africans said, no, we'd like to come back. And now that they've said so, we're going to prioritize them and bring them back. Right now, the figure keeps changing. Right now, the figure we have is that about 201 South Africans are living in the area of Wuhan, and 151 have indicated they wish to be repatriated. So a few days ago, we had a number which was different. At some point, we had 80, and at some point the number went to 130, and then of course now the figure is 151. The repatriation process will be implemented in 3 phases, namely the evacuation, the 1 phase, the quarantine, the 1 phase, and the reunification. Those are the 3 phases that we're going to be focused on. All the staff, support staff, that will be handling the quarantine process will also go into quarantine themselves. So that is now to seal the whole chain, so that anyone who could have been exposed will actually be brought in. We've also, as Department of Health, made a recommendation that when they load those passengers in, if there's anyone that might be requiring any sort of isolation inside the particular aircraft, there should be provision made so that they could be isolated en route coming this way. We want you to stay until day 14, then we start doing the test and then wait for the test. So within that last week, we're basically just wanting to be sure that we have got the results back. We also want to make sure that we begin to explain to the individuals and counsel them so that when they get to the community, how do we deal with the issue? The real concern we want to make sure we don't run into is a problem of stigmas. A 24-hour clinician hotline was set up, as well as a working hours hotline set up for the public. The public hotline number is 0800 0800 29999 and operates from 8 to 4. And if in South Africa, if we were to confirm a case of coronavirus, the public hotline would be converted to a 24-hour hotline.